It's 4:30 p.m. here in Seoul. I'm Devin Whiting at the Arirang News Center, and it's time for today's briefing from the South Korean health authorities. We should be getting updates on the latest case numbers and trends, also progress in the vaccine campaign, and possibly updates to the social distancing measures in South Korea. It looks like the briefing's about to start now. Let's listen in.
And we will now start the untagged regular briefing. We will have the presentation from Mr. Son Young-rae of the Central Disaster Management Headquarters. We will be providing sign language translation. First, we will hear from Mr. Son Young-rae about the countermeasures against COVID-19.
예, 5월 2일 일요일
I will now
정례
start the regular
브리핑을
briefing
시작하겠습니다.
for Sunday, May
지난 한
2nd.
주간의 유행 상황에 대해
I will now update
말씀드리겠습니다.
you on the developments for the
일주일
past
하루
week.
평균
Over
국내
the
환자
past
수는
week, the average
597
confirmed
명입니다.
cases amounted to
직전 한 주간의
579.
659명에 비해서는
Compared to 659 from the previous week, it has actually a decrease by 9.2%. And the reinfection rate is at 0.9, which is a bit lower compared to the previous week. And we are seeing that there is a slight decrease in the increase in the number of patients. And we believe that this is thanks to the efforts made by our citizens and also the prohibitions of the entertainment facilities. And I also believe that this is thanks to the increase in the outdoor activities as compared to indoor activities. For the 5 regions that had a high number of patients, we have seen a decrease in the Gyeonggi region, and for Ulsan and Gyeongnam and Seoul regions, it is actually similar to the previous week. And for the Ulsan region, the variant form of COVID-19 is on the rise, so we still have to be careful. Right now, we have no problem for the medical system. We have 71% secured, and there are more than 500 hospital beds that are still available. And there are no patients that are waiting to be hospitalized. And also for those that are critically ill, we still have around 57% of room. The family month is coming up with May, and we believe that there would be an increase in contact between people, and that could increase the risk of the infection. Therefore, we want to ask our citizens to refrain from having any gatherings or events. And if it is a must-have, then we ask you to have it as an outdoor activity rather than an indoor activity. It is safer to have outdoor sports rather than having indoor activities. And if you are also having indoor events, please make sure to ventilate often. Today, in the Central Disaster and Safety Countermeasure Headquarters, we talked about support. With the lengthening of COVID-19, a lot of small businesses are having economic difficulties. The government wants to support these small businesses and lower the burden. Therefore, we're going to provide more than 4.2 trillion in some areas, and in total, we're supporting 14 trillion won. We are seeing that there is a stopping of businesses for some small businesses, and based on that and in consideration of those small businesses, we are providing support. And we are making sure to provide the subsidies as soon as possible after application. The application started in March 29, and until April of 29, around 4 trillion was paid out to more than 270,000 businesses, and we're going to continue our support. For the Jeollanam-do province, we will have a pilot of the new social distancing measure. For the Jeollanam-do province, within the province, we only have around 2 newly confirmed cases per day. Therefore, we thought it would be appropriate to pilot the new type of social distancing measure. And the Central Disaster and Safety Countermeasures Headquarters also decided to go through with it after receiving many opinions from experts and the relevant personnel. Compared to the 1.5 level, there hasn't been much of a difficulty. And for prohibition of the private gatherings, we're going to allow it to 6
다만
people and we're
광주와
going to
인접한
increase it in a
인접
stepwise
지역들과
manner.
대도시 인접 지역,
However, for the regions that
관광지의
are close to
방역 강화,
Gwangju
버스형
and
이동
other
검사소
metropolitan
운영 등
cities,
지역 특성에
and
맞는
also
방역
for
조치도
the
함께
other
강화할
areas that
예정입니다.
are more crowded, we're going
자세한
to
사항은
apply
전라남도에서
measures that are more
세부적으로
appropriate for
발표할
the
예정입니다.
regions, and details will be provided later on.
예방 접종에 대해
Now
설명드리겠습니다.
I will explain about
일부
vaccination.
언론에서 화이자가 바닥났다라고
Some media
해서
is saying
접종이
that Pfizer
가능한지
vaccines have run
불안해하실
out,
분들이
and a lot
많을
of
것
people are
같습니다.
probably concerned about
그렇지만
whether they
이는
can be
사실이 아니라는 점을
vaccinated.
말씀드립니다.
However, I want to
현재
tell you
화이자
that this is
접종은
actually not
3주
true.
전 1차 접종을
Pfizer,
받은 분들에 대한
for
2차
those
접종이 집중적으로
that got the
이루어지고
first
있습니다.
dose 3 weeks ago, we are
이로
starting
인해
with the second
1차
dose
접종
now.
대상자들은
Therefore,
대상을 줄였다가
those that were
5월
subject to
하순부터 다시
the
1차
first
접종이
dose
집중적으로
were
진행될 예정입니다.
decreased. However, we're going to increase the number
화이자에 대한
of first dose
국내외의
vaccines
여러 검증
in
결과로는
the middle
1차
of May.
접종만 해도 약 90%의
And
예방
for
효과가
Pfizer,
나타나며
it's quite effective. So even after first dose, it is 90% effective. And we believe that after the second dose, 3 weeks later, it actually increases the effectiveness. Therefore, it is our goal to make sure that the elderly gets vaccinated with the first dose as soon as possible, and that is the plan.
이에 따라 시기별로
Therefore, depending on the region, there are periods where we have concentration of first doses and also other periods where we have concentration of second doses. And depending on the vaccines, the number of those being vaccinated also vary. And we're trying to ensure that we vaccinate the elderly as soon as possible through this. We don't have to store the second dose right away because that will actually cut the number of elderly who can be vaccinated by half. And it will also delay the second dose. And the same principle is being applied for AstraZeneca as well. And a lot of the other countries are also focusing on vaccinating people with the first dose as soon as possible. Therefore, in May and June, we're going to focus our vaccination on the elderly and those in the medical fields and those who must be vaccinated. And we believe that we'll be able to vaccinate around 12 million soon. So we want to reassure you that you don't have to be concerned about the vaccines running out, and it is not true that we ran out of Pfizer vaccines. The government in May and June is trying to assure the vaccination for the elderly, and we also had the plan to vaccinate 12 million people in the first half, and we are trying to meet that goal. Until now, we haven't seen any trouble in the supply of vaccines. Some were pessimistic that it would not happen. However, the vaccination for 3 million people by April has been met. And for those elderly who are more than 60 years old, we're going to make sure that they can be vaccinated in May and June for 2 months. It is very important for you to be vaccinated. Please don't worry too much, and please make sure to participate very actively. We want to ask you to adhere to the set dates for vaccination, and we also want to ask the media and to the society. We want to plead to you to not have any articles that are too concerning, because that would actually increase the confusion and trouble vaccination system, and it is not beneficial to anyone in the society. Especially, please don't provide information that are incorrect and based on predictions only without scientific grounds. And it is also the same for vaccination. Last winter, when we were doing the flu vaccination, there were increase in the media articles, and there was a release on the internet. And as a result, we have actually seen increase in the number of death cases. The experts analyzed this, and there were really no cause and effect that had medical grounds
특히
to it.
고령층의 경우
Especially in the
매일
case
많은
of the
분들이 질병이나
elderly,
사고 등으로
a lot
돌아가시고
of
있기
people
때문에
actually
이로 인한
die from
사망과
diseases
예방접종이
or accidents.
시간적으로 일치하는 경우가 많습니다.
And in a lot of cases, it is in time with vaccination. A lot of people don't consider this cause and effect. And if we only deduce our opinions from it, that means that increases the number of confusion and it will actually make the elderly more concerned about vaccination.
지난 겨울철
And we have seen a lot of interest on the abnormalities after vaccinations, and we are actually concerned about such a growing interest.
최대한의 과학적 검증과
We want to ensure that we have scientific grounds that support the information that are shared, and it must be done so.
부정확한 과장,
The society must refrain from providing information that are incorrect and that are over-exaggerated. So we want to ask you to share information that are with scientific grounds. Dear citizens, we are still facing a very difficult time due to COVID-19. However, we believe that we are at an inflection point and a transition period where we are seeing an end to it. In May and June, we are going to achieve vaccination for 12 million people, including the elderly. This is 2 months. After these 2 months, we will get close to our daily lives and we will see stability. More than 95% of the deaths are coming from the elderly. Therefore, once we can vaccinate the elderly, we believe that the risk of COVID-19 will dramatically decrease. So we ask our senior citizens to not be worried and be able to be vaccinated. If we can control the spread to be less than 1,000 in June, and we want to also make sure that we are vaccinating the elderly, and once these goals are met, we believe that we'll be able to alleviate social distancing measures. However, this cannot be done only with the efforts of our government. We need the help of our citizens for us to achieve this. We want to ask you to think of not only yourselves, but of those around you and your families and loved ones so that you can be vaccinated. Refrain from having any gatherings and please make sure to adhere to your personal hygiene measures such as washing hands and wearing masks. And please make sure to ventilate a lot when you're indoors. The government will also make efforts so that we can help our citizens achieve daily lives as soon as possible. Thank you.
지금부터 질의응답 시간을 가지겠습니다. 브리핑은
And that'll conclude our coverage of this briefing. Thank you for watching. Arirang News will be back at 6 p.m. Korea time. Bye for now.